It's my pleasure to introduce our Director of Responsible AI Practice, Dr. Cansu Canca, who's a leader in developing and implementing ethical and responsible AI solutions, coming from the perspective of an ethicist who's also been deeply steeped in both the life sciences and medical research. So we're thrilled to have Dr. Canca tell us about responsible AI and how we integrate that into the solutions we develop at Northeastern.
All right, thank you, everyone. Thank you, everyone, for staying, first of all. So I come from bioethics. I'm trained as a philosopher, and I spent more than a decade working on population-level bioethics. Basically questions about ethics of public health, bedside medical ethics questions, questions related to health policy. And the way that I started thinking about AI ethics was because of the gap, the previous slide, the gap about the ethical analysis that we are able to do in the healthcare space once AI is introduced. So let me start by why, then what, and finally when. So why do we need responsible AI? I'm hoping this doesn't need much of a convincing, but still, there are multiple ways of showing why this is really important. So everyone by now, I think in the healthcare space, knows about the Obermeyer study, basically showing that the commercially available and already at use algorithms that we use to assess risks of different groups for providing health care has been racially biased. And this also showed that once we fix this bias, we basically get almost double the size of Black patients receiving care that they should have received otherwise. And this was not because any of these people who were creating these algorithms meant to be racist, obviously. That was only because wrong proxies were used. And this question of proxy comes up very often because it's not anymore just the most obvious proxies like zip code to race. There are many ways that AI systems are able to catch the demographics, catch the vulnerable groups that we do not want to catch. Similar cases have happened with gender. So this is just one, and actually from 2022, and the same group did many other studies looking at different medical devices, the approaches, AI systems, looking at risk assessments again, and gender bias in this case was revealed in AI tools screening for liver disease. So is it just about bias then? If we fix bias, can we fix the problem? No, well, we have other problems. So this is a case that we are watching because it is not yet resolved. United Healthcare was accused for using AI wrongfully. And in this case, this is a very rich case where not enough information, not all the relevant information, was fed into the system that was supposed to determine who should get more medical care after acute care. And another aspect of this case that is very interesting is because this had human in the loop. All of the recommendations went to the human claimants and decided by humans. But what happened is that the physicians' recommendations were overridden, and those who decided whether or not their expertise versus the recommendation from the AI system should be followed were incentivized, in fact, punished if they did not follow the AI system. So it also shows that it's not just about what kind of an AI system that we are implementing, but it's also about how we communicate the AI system's results and in what kind of a accountability system structure we are implementing AI systems. Another case that has finalized is that in Tennessee, the Medicaid benefits were allocated using a $400 million algorithm, which turned out to deny thousands of people illegally. Again, lack of information, lack of relevant information in the algorithmic system was the main reason here. So, okay, is it all about the human-computer interaction, having all the relevant data in place? Not just that either, because we also still have the privacy problems. So this is an old ProPublica case where your medical devices that, I'm not talking about the smart watches or anything, I'm talking about your heart monitors, your sleep apnea devices, keeping and gathering more and more data about you and sharing it with places, with third parties that you don't know about and you wouldn't want to if you knew. And you could say, well, we can de-identify the data. Well, the studies do show a lot of the times the identification is reversible. You can re-identify a lot of the data. So the issues are, we have a variety of issues. It's not just about privacy, and you cannot just rely on the laws around privacy. It's not just about bias, although bias is huge. And if you thought about how do we deal with bias, you have to get into the bias and fairness. You have to get into the very complicated area of what does fairness mean in insurance versus in acute care versus in decision-making during pandemic. And those decisions will be requiring social science information and philosophical information about what is fair. So why does AI bring all of these new questions? When we think about when we do an ethical analysis, all of you are familiar, coming from healthcare, all of you are familiar about bioethics, medical ethics, research ethics, the IRBs. And when we think about the ethical systems, we want to have the full understanding of all the decisions, all the value judgments that go on into this case. So we want to understand the patient's perspective, the impact on the patient, the clinician's perspective, the researchers, the impact on the clinician and the researcher, the hospital and healthcare system. Now, when you introduce AI, what happens is that you are talking about the public health ethics, the medical ethics, the research ethics, what is the right thing to do for the clinician, what is the right health policy, but you are not talking about what is the right technology to use and how to use it. So the AI and technology ethics comes in play here. And if you don't address that, you do not address the full ethical questions, full ethical spectrum of a given healthcare case. It's as simple as that. So how do you do that? Responsible AI, AI ethics, however you want to call it, more or less the same thing, has three main aspects. One, we want to make sure that the systems that we create have the correct, right value judgments embedded in them. So none of the systems, none of the AI systems come objective. All the decisions that go into your choice of data, your choice of model, where do you want to use it? Why are you even creating this system? All of these are value judgments. If you don't do these value decisions explicitly, chances are you're making them implicitly and wrongly. If you're making them explicitly, at least we can go back to what was the decision and fix it if it is wrong. The second part of it is we want to make sure that the process of building the technology is ethical. So there you have this combination between research ethics and AI ethics. How do you do AI research safely? And the last one is that AI systems are not just going to magically do the thing. Well, humans will have to work with them, which means that we have to understand how the system works. We have to be able to have a connection with the system, collaboration with the system, so that we can use our expertise and really make sure that AI is augmenting our performance. Having a human oversee AI system, having a human in the loop in itself is meaningless. Because if you don't understand what recommendation the system is making for what reason, it's almost like a coin toss. You can say yeah or no, but this is not collaboration. So when we think about questions like, what is the accuracy of this model? The question that we want to ask is, when the model is not correct, who is getting affected? Is there a particular group that is being disproportionately affected by the mistakes? We want to say when the system says, do X versus Y, this person has more likelihood, more risk. We want the physician to be able to understand why, and also to be able to understand how confident is the system. So all of these are things that you have to built into the AI system as we are creating them. So that also shows you that the span of responsible AI is really not like in one point. You cannot just, I asked an ethicist, well, how many times, at which stages of building, developing, and deploying a product? Well, it has to be starting from the research phase, and it has to go through the whole AI lifecycle. And it has to include all the aspects of the AI system. You have to look into the data, you have to look into the model, you have to look into the user interface and the user experience, and how this is incorporated in the practice. And when we talk about the mitigations of risks and the safeguards, it's not just about the technical mitigations, it's not just about the tweaks, but it's also about making sure the human aspect is able to safeguard and mitigate the problems. How do we think about these? Well, again, for those of you, for all of you coming from healthcare, it's not very different. We are still doing ethics. So we are still looking at the individual autonomy, harm benefit, the social justice, and you can say, well, that's Belmont report, that's the biomedical ethics, I know this, I can just do this. No, you can't, because the questions are really not answered in the Belmont report. We know about informed consent from Belmont report, we know about the risk-benefit assessment, the privacy and discrimination, but the questions that AI and the digitalization introduces about how to think about the secondary use of data, the third-party models, how do you withdraw from a research when you are a part of big data, how do you think about re-identification, group privacy, none of these are answered in the Belmont report. Absolutely not. You have no guidance from Belmont report. And Belmont report is just a reflection of the biomedical ethics. I can tell you, you have no guidance from biomedical ethics either. You do have guidance from moral and political philosophy. You do have guidance from the rich applied ethics literature, but not from directly the existing shortcuts. So what we do, we create tools that reflect the nuances. So this is a prototype, the very early version of one of the tools that we use a lot. It's called the Box. It's still structured in the same basic ethical setup, so autonomy, harm, benefit, and justice. By the way, why? Because, well, 2,000 years of philosophical research shows us those are the core values. But then we go into and ask, like, what are the relevant aspects of these values that now applies to AI-related questions? So we look at the human control, we look at the agency, and we look at the distribution of burden and benefits, but this time looking at the AI system and how that AI system comes into play. Again, this is an earlier version. You can find it on the website, but we are using a much more sophisticated version of this by now. So, in a broader sense, that tool, for example, plugs into the AI innovation lifecycle. We want to make sure that every AI system we develop starts with impact analysis and risk mitigation. We understand the impact on the society. From there, we start thinking about ethics by design. What does that mean? We make ethical decisions and turn them into action items. Ethics is not about just trying to be the good person, having aspirations. It's about taking action. So what is your ethical decision? What value did you just say that your company endorses? How does that turn into an action item? And how did you incorporate it into the AI model? If you haven't, you're just talking about it. And of course, we have to keep doing the monitoring and the technical analysis. To keep this life cycle in place, this process in place, we have to have the playbook, which means all the tools, all the guidelines, the company or we have, organizations, and the right expertise, right people in place, which again does not mean just to have a board. It means have the right expertise with accountability, with roles and responsibilities, and decision-making lines so that there's communication. Not everything should go to experts. We can make sure that, I'm seeing the time, we can make sure that the people who are developing AI systems can use easier tools to assess the risks, and if the risk is really high, then they call the experts. And that's your responsible AI governance system. And if you're in healthcare, that means you are dealing with an ethically loaded area. If you have medical ethicists, bioethicists, that's great. If you don't have responsible AI governance, you're missing something, for sure, no question. Traditional practice that we have in research ethics at academia usually asks the ethics assessment, ethics review, at the beginning, like the IRB style. You submit your protocol, and you get the go-ahead, that's it. The technology people usually ask right before deployment. So they have the model, they're like, we're about to deploy, is this ethical? Is this fair? It's too late. Well, we can still help you, but it will be, we're going to waste some resources because we are going to have to fix things now, most likely. It has not been the case. I have not seen a non-problematic case. What do we want? Well, we want ethics to be integrated. We don't want to be the policing overseers, because this is not the point. The point is to make sure that we work together. So ethicists, computer scientists, my team has ethicists, computer scientists, working together to make sure that the problems are resolved at every step so that you continue with confidence and without wasting resources. And the very last thing is when should you do this? It's like the white rabbit in Alice in Wonderland. I mean, if you're asking, you're probably late. And at the risk of angering my colleagues, if it is the last session in the conference, it's too late. It's after the time, it's already too late. So it's sort of like, and I know what most of you say. So my colleagues will say, but we've discussed this throughout the whole day. I know, I've been here. Most of you in the companies will say, look, we have people on top of this. The legal is watching it, the privacy people, the security people. I know that. But like what I'm telling you is like, you have fires. Like you have little fires, and they're making to the headlines. And you're calling me that we are talking about it. And you're saying that we're calling the police. Why are you not calling the fire station? Like, you know, the people who have the expertise and the tools to actually do something about it, to put out the fires, and also to fire-proof the system. So, well, let me know when you need my team. Thank you.